It is Wednesday, May 13th, 2020. I'm here talking to someone who actually hit me up on Twitter. He had been listening and checking out some of the COVID conversations and actually saw what he was doing. It's actually pretty cool. His name is TJ Muehlman. I would safe to say you're a part of the Atlanta tech community, maybe, if that's a safe way to say that. He actually has his own company, but he's done something really interesting with the COVID mapping project that I think is worth talking about today. And so we're going to get into that and what that means. And then also just TJ can help kind of explain some things that people are seeing online, especially just when people see data and they see numbers, it kind of all flies all over the place and we're all kind of confused. So thank you, TJ, for taking out time to talk to me.
Yeah, thanks for having me.
All right. So just a little bit of background, so who is TJ Muehlman?
Yeah, so my name is TJ Muehlman, and I run a company called Standard Co. We are a global health data provider. So what that basically means is we work with like the CDC, the World Health Organization, Gates Foundation, to help them collect and understand data about disease. And the interesting thing is we've been doing this for about 7 years, and up until March 12th, we've used our platform in 63 countries.
Oh, wow.
Mostly in Africa, South Asia, and South America. And then on March 12th, we launched the COVID mapping project, which deployed the same technology we use all over the world to our 64th country, which was the United States. And we're basically helping people collect and understand the data around COVID, and to help paint a little bit clearer picture about what's happening, how many tests are happening, how many cases there are, and things like that. And this is something, again, we've done a lot of. It's what we do. It's our day job. And now we're using it for COVID.
Okay. And so I want to be, before we get into COVID for a second. So your business operates in 63 countries before you came to America?
Yeah, and to be clear, we're a U.S.-based company. Our platform, it's a combination of a app on Android and iPhone for collecting data. Think of like a Survey Monkey, but on steroids. It's for conducting really elaborate surveys in the field. So, for example, I was in Kenya back in June of last year, out on a coastal town. And what we were doing is we were going to schools, rural schools in Kenya, and watching children be treated for a disease called schistosomiasis. Most people haven't heard of it, but it's a disease that affects about 2 million people around the world every year. It kills tens of thousands. And they use our platform to make sure that these kids are treated. Do they have adverse reactions to the treatments and that sort of stuff? So they use a Android phone to collect this data, and then it gets sent to our platform where we do all kinds of cool data analysis and paint really pretty pictures around the treatment campaigns, like how many kids are treated, how many tablets were used, how many kids had severe adverse reactions, and all that sort of stuff. So it's been really fascinating because I really love the intersection of technology and impact. How can we use technology to improve people's lives? And in fact, our sort of mission statement is use data to transform lives. How can we make people feel better? And up until March 12th, we've been using this almost in every country in Africa and a significant chunk of Asia and South America.
Okay, so how did you even get into that in the first place? Because that seems very specific. It's very much not where you live at. So you gotta.
I know. It's a wild story, man. So I've been in technology for about 20 years, and like you said, I've been doing tech startup stuff of all kinds, really, since I got out of school in 2000. And somebody called me in 2013 and said, "Hey, can you guys build an app?" And I said, "Well, I can't build an app because I suck at building apps, but I know somebody who does. One of my business partners." And they said, "Okay, can you build an app that works online or offline?" And I'm like, "Sure." "Can you build one that works in the middle of nowhere, in the Congo, for example?" And we're like, "Cool, let's give it a shot." So I don't have a background in public health. I'm not an epidemiologist. But we started doing this work and we were like, holy shit, this is fascinating. Like, this is just, so neat, because not only are we kind of deploying our sort of mantra of like, how do we make people's lives better with technology, but we get to a lot of the work we do, again, in Africa is with children, and that's just sort of a fascinating thing to get to do. And we get to travel a lot. We get to go to these places, and it just by luck. And so we started doing that in 2013, and that was maybe 5% of the company. Like the other 95% was just building apps for people. But by 2015, it had sort of consumed us. It became all that we did. And so for the last 5 years, it's been basically 100% of our business.
Oh, wow. Okay. So I have more questions now. In particular, so I want to just be clear, you've done your entire tech run in Atlanta, or has it been other places?
In Atlanta. So for the last 2 years, I've lived outside of Seattle. So I went to college in Atlanta and lived there for 20 something years. And Atlanta's still my home. My heart's in Atlanta, but my body's in outside of Seattle because I have family out here. My wife's from here. Okay. And we have little kids, and so we get a little bit of help with family. But I come back to Atlanta. The company's still based in Atlanta, so I come back about once a quarter, or I did before COVID. Right. But yeah, Atlanta's there's no better place to start a company or run a company. And I'm taking this off on a little tangent, but I just love Atlanta because I think you've got all the ingredients to do really fascinating things there. You've got the people. You've got such a great cross-section of people there. You've got ambition. You've got opportunity. And I just big fan of Atlanta, and I'll always be a big champion of Atlanta.
Nice. Okay. And so just kind of to even bring things a little forward now from that point. Yep. Your business has been primarily, you said you've been working mostly mobile applications, in particular Android. So why was that? Like, why not be for all developers, or just why in particular just that focus?
Yeah. So we focused on Android because where we're working, we're essentially, if you think about in public health, if you're doing a survey, if you're wanting to understand how a disease is spreading, or you're wanting to map something, what was used to be used was paper. And so they would go out into the field and take pen and paper and kind of collect this information. They still do in most cases, in fact. So if you're going to replace that with something, you need to do it with a technology that's cheap, with something that's easily deployed, something that can be replaced fairly quickly. And Android fits that bill. And we have a really robust iPhone app, and we have a server side stuff that we do. But Android is just like, I can go out and buy, $50, $100 Androids right now, of all varieties and all shapes and flavors. So it just made it really easy to deploy software out in the field, and the battery life is pretty good because you're thinking about, like, when I've gone out in the field with folks, and I've done it now 5 or 6 times, you're out there for a while, right? Like, you're not really you're kind of out in the middle of nowhere without access to power, so you need something that's pretty durable.
Right, makes sense. And so I just want to ask you too about the pivot. You said by 2015 you had fully pivoted to working in this space. Was that so for your business anyway? Was that hard to do, or was it like difficulties in doing that? And how did that work out?
Oh, totally. I mean, I'll be honest, we're kind of still pivoting if you think about it. We've always looked up to MailChimp for a variety of reasons, right? Who doesn't love MailChimp? I mean, they're bootstrapped, they're quirky, they're weird, they give back to the community. And there's all things that we've sort of admired about them. And we've tried to emulate them as much as we can. And in some ways we've, I think, been successful, and some things we're still working on. So when we started, we were a services business. We had people that we would go out and find jobs, and we would do custom development, and then we would find more jobs. It was never something we wanted to do long term. It was never really in our heart to be a services business. We've always been product driven. Like, we like building stuff, and we like owning the product. So that transition was certainly tricky because it meant turning down things that were lucrative but not directionally where we wanted to be. And so it meant saying, I'm going to give up revenue for the vision of building a platform for global health.
I got neighbors. Hold on 1 second. Okay. And thank you for that. And so, and I wanted to ask you in particular, which is, a lot of people do look up to MailChimp, and a lot of people are still kind of learning about the Atlanta tech scene. And when they do think about it, it is honestly MailChimp is usually the first one that comes up, or maybe David Cummings and what
Yeah.
what would you say to people who don't really know about Atlanta's tech scene, that what it is and what they should know about it?
Well, I think I think what I love about the Atlanta tech scene is it's scrappy. There's a lot of really cool companies that have done a lot with very little. And I think that works well. I think, the sort of Southern mentality can be kind of being humble. And I think that works in a lot of ways, but I think in a lot of ways it also works against us. Like, for instance, I love building things. I don't necessarily love talking about the things I build. I just kind of I hope people will find them on their own, but I recognize that that's not always the case. And so I have to be more proactive about reaching out. I think on the West Coast, I think West Coast has a more prideful mentality, and that don't mean that in a negative way. I think they're maybe it's a good euphemism. But I think the Atlanta tech scene, it's a bunch of people who rally around each other. And that's the other thing I love about the Atlanta tech scene is I know a bunch of founders in the Atlanta tech scene that I just really love, and they're always there if you need something, right? And they're always willing to champion you when you need something. So I think it's just a bunch of doers. It's a bunch of people who want to get shit done.
I like it. All right, and so now I want to get into your company and your company. Question. I'm sorry, I'm so used to like the investigation side of it, but no,
yeah.
In particular, and then what you guys and how that became the COVID mapping project.
Yeah, so COVID mapping project is interesting. Actually, it was derived from. It started actually not as a thing about the United States. It actually started as a way of charting what was happening in Africa. I spend a lot of time in Africa. It's personally my favorite place to visit. Professionally, I think if you're not thinking about how to work in Africa, you're missing an opportunity because
what country is your favorite?
Rwanda.
Oh,
I mean, Rwanda is mind-blowingly beautiful. Every country you go to, the people are fascinating. But Rwanda has this stigma, I guess, associated with the genocide in the early 90s. And I think a lot of people assume that it's sort of still stuck in that. And if you go there, you're like, wait a minute, the infrastructure is better than anything in North America. The hotels are way nicer. Food's pretty damn good. And the people are amazing. What's not to like about it? So that was pretty great. Botswana's great. Congo Brazzaville is pretty cool. They're all different, and I think everybody sort of thinks of Africa as like a nation, and it's it's dozens and it's big. But we actually started COVID mapping of when you went to that famous Johns Hopkins chart. It was the whole world, or it was Europe, or it was North America, but there wasn't one dedicated to Africa. And so we actually started COVID mapping as one dedicated for Africa. So you could see country by country, the spread of the cases. And so we had built that. And the reality is that COVID just wasn't hitting Africa back in February and March the way it was starting to hit here. And at the same time, I noticed that, like, if I went to Georgia, Georgia's Department of Public Health website, the data was kind of all over the map, and we'll get to that here in a minute. And then if I went to Washington, where I live now, it was all over the place. I went to Texas, where I have family, Louisiana. I went to different states, and the data was represented differently. Gotcha. And it was confusing. And I was like, well, I want to compare apples to apples. So I'm like, well, this is what we do. We take data from all these different places, these different buckets, and we put it into one place so I can actually say, well, here's what's happening in Atlanta, or I'm sorry, here's what's happening in Georgia, here's what's happening in Texas, and it's the same data, and it's the same visualization. So we created COVID mapping as a North American or United States tool to kind of solve the problem of seeing the data all in one place and not having to like hop between all these different sources.
Right, and that was actually I didn't realize how beneficial it was until you actually come across it, like you said, because I read way too much for just like work purposes or things like that, and just trying to find good information on COVID is something I haven't fully ventured into because I didn't know about your site until like I actually had to go through your profile and things like that.
Yeah.
It's been hard for people to understand just what data is out there. And can you kind of help people understand what's been going on out in the data space? Because there's too many things for people to really understand.
Yeah. Well, I think this is going to be, I think, sort of a watershed moment for the way we look at data and the way data tells stories. I think a lot of people have always sort of assumed that data is just a fact, right?
Right.
You can't really screw with it and twist it and turn it to tell a story. And I think what we're finding is actually you can, and it's actually really easy to use data to sort of advocate for a position. And I think Georgia's a great example of that. You see that with Governor Kemp, where if you go to the Department of Public Health website in Georgia and you look at the case growth rate, you will see kind of like the bell-shaped curve. And at first glance, what you're seeing is, oh, well, everything's cool in the gang. We could totally go back to work and go to the park and then reopen and everything's fine. And the reality is that that curve is really misleading. It's a fairly common way of representing data in an epidemiological sense for people who work in this space. It's not abnormal. In fact, it's totally kosher. But to the average person, the way they look at that data, they're like, oh, we only had 30 cases yesterday. Sweet. But that's not the case. It changes. And in fact, for the last 14 days, the data is constantly going up and changing. So it's just the thing that we're trying to solve for is to take the data and lay it out in a way that you could look at it. You're a storyteller, or I could look at it. I'm a data guy, or my mom could look at it, who's 75 and lives in Texas, right? Like I want anybody to be able to look at it and come away with the same set of facts. That here's the growth rate and here's what's happening. And I'm not trying to advocate for a certain position. So the data is just all over the map, and it gets worse when you try to compare like Georgia to Alabama or Georgia to Texas and Louisiana. Everybody's got their own way of telling the story, and we're hoping that COVID mapping project and other sites like ours are sort of centralizing and consolidating the information.
Right. So can you walk people through, if I'm going for the first time to COVID mapping project, what does that look like for me? Like, what do I need to look for? How do I go about finding information?
Yeah, so when you go into COVID mapping, it's very straightforward. The first thing you see is the country, is all 50 states. And if you're on mobile, you see a list, and if you're on desktop, you see the country. We decided very purposefully at the beginning not to show like the dashboard of country statistics, because we think that's been done. We're not going to reproduce that. We're not going to do it better than Johns Hopkins or COVID tracking or New York Times. They've all got that nailed. What we want is for people to drill into whatever state they care about. And Georgia, because you're based in Atlanta and I'm in Atlanta, Georgia's the most topical. So if you go into Georgia, what we've done is we've sort of created two sections on the site. We have what we call case studies, which are the links at the top. And what we've done is, we work in public health. We are not, again, we're not epidemiologists, but we're data people. So we've written some thoughts about the way Georgia counts cases. We've written some thoughts about testing, and we've written some other kind of case study type things. And those are more sort of storytelling or narratives, right? Blogs, if you will. And then if you scroll down, then you kind of get into the hard data. And what we've done is we've kind of listed out, we have a map, we have all the counties, which counties have the highest counts. So Fulton's at the top, Dougherty County down in Southwest Georgia, DeKalb County. And then, individual blocks that sort of represent the cumulative, like how many cases are there right now total? And then the day-to-day changes, which is maybe the more, I wouldn't say controversial, but that's the more, the area where people have some questions about how the data is captured and used.
Okay. 1 second. Like I'm next to a window, so it's open that you can hear. I don't know if you can hear that. Like I think it's a garbage truck driving by or something.
Wait, where do you live? What part of town are you in?
Like east side, like East Atlanta. So.
Okay. We lived in Kirkwood for a long time.
Got you.
I missed it. Anyways, go ahead.
Oh, no, I just was trying to make sure the garbage truck went by.
Yeah.
But no, so I wanted to ask you in particular the controversy part. Can you speak to what that is and why people have controversy about it?
Yeah, so it's the biggest controversy in Georgia and it's actually happening in Kansas and a few other states, is this notion of how do you count how many cases change per day? And that's what a lot of people are fixated on. I'm of the mind that it's maybe not the most important indicator. I think testing and how many people positive versus number of tests is the most important indicator, but we can come back to that. In Georgia, the way Georgia tracks the number of new cases is through something called when did the symptoms surface in a person? So for example, let's say today on May 13th, I get a fever, I start coughing, I develop the symptoms of COVID, but I think it might be allergies, okay? So I wait a couple of days and I get tested. I get tested on May 15th. The results come back on May 17th. Say, TJ, you're positive. What Georgia's doing is they come back to me and say, well, TJ, when did you first start feeling sick? I will say May 13th. And that's when they put me on the chart as May 13th. For epidemiologists use this all the time. There's nothing wrong with it. But the problem is that because you're constantly going back in time to find out when somebody first started feeling symptoms, the data is always evolving for at least 10 to 14 days.
Gotcha.
So May 13th might say that there were 30 new cases. And then when you look tomorrow, May 13th will be revised up to maybe 50, and then revised up again to maybe 100 and maybe 200. It's always changing. So that curve that goes like this will eventually kind of start to level out or maybe go up. And the trick with that is that the general public doesn't really understand by looking at a visual that they're looking at data that is not yet finalized. And I've seen it all over the place where people are like writing in articles like, oh, there was only 30 cases. And like, no, that data is not final. It's changing. So it's leading to a lot of confusion. And it's kind of gotten to this point where they've revised their charts just in the last few days to kind of signify that it is very fluid. But it's opened a lot of doors around what kind of data do you publish? And what kind of data do you sort of say, this is not ready for public consumption, right? And I think that's the big controversy or it was the big controversy in the last week or
two. Okay, and I gotta ask, people might ask me to ask you, which is, have you guys been contacted by anyone with the state or any other states right now for better data or just questions or anything like that?
Yeah, so we've talked to a handful of states. So we've talked to some folks in Georgia, we've talked to people in Louisiana, Texas, and Washington. The reality is that we've already launched COVID tools in now Uganda, Kenya, and Peru, and I'm fairly certain that will expand. So our footprint is much broader in global health community. For whatever reason, I'm much more likely to find me in a Ministry of Health office somewhere in Africa than you are in Washington, D.C. Like, I just weird. I know it's weird. And I never thought I would say that. But yeah, we're just much more connected to the global community than we are the U.S. community. So what we're doing so far is really just because we want to see the data in a better light. So it's been a volunteer effort. There's been a whole bunch of folks who have helped us build it. So not only people at Standard Co., but friends at other companies, freelancers who have just sort of said, I want to chip in and help. And it's been a really, and it's the best of the Atlanta community, right? It's the best of people who are just like, I want to help out, and I'm not going to get paid, and I don't really care to get paid. I just want to help. And that's been really one of the more, the best parts of this whole thing.
Yeah, I was going to ask you, because this seems like they're either time consuming or very like expensive. I'm glad you answered that, because I was going to ask, like, how is that being funded?
Yeah, it's not. If any of your listeners would like to fund this, but it's one of these things. In you could probably relate when you're an entrepreneur and you're a founder, you find these problems that just sort of take over your life. Yeah. And I think that's one of the biggest signifiers that you are a founder, right? Is that you find a problem and you're just like, I'm gonna fuck with this problem until I can't sleep, until it just forever. And right. This for me has been something that I've got 2 little kids, and so when my kids are sleeping, I'm probably messing with this. But we have clients who actually need stuff done, so I've got to wedge it in there somehow. But when you're doing that, it's so fun. I mean, I hate to say it, COVID's a terrible thing, and it's led to a lot of misfortune and death and sickness. But from a data perspective, it is a fascinating thing to work on.
Oh, well, I mean, that is one of the things. I think your project in particular is one of the more positive aspects to come out of this. And it's also one of the more interesting ones because it's one of the few times in which I've seen quality information come out there consistently from somebody that's not directly working for a health organization.
Yeah.
In the age of like all types of wild stuff that's being said about COVID on Twitter or on YouTube or on Facebook, it's refreshing to know that there's somebody out there doing really good work, trying to do the best of what they're given. And I just want to make sure that like that voice is amplified more than what we're seeing right now.
Oh, I appreciate that.
Yeah, because there's going to be
Thank you.
Yeah, there'll be some new conspiracy about I don't know, and those are like everywhere right now.
And actually, I wrote a little bit about that. I was telling somebody who had sent me that pandemic video, and I watched it, and I was just like, there's a lot of. I'm not a conspiracy theory guy. Like this is not my DNA. But there's you get those conspiracy theories where you're like, I could see that. But in public health, right, of all the people to be like the least conspiratorial, it's public health people.
Yeah.
And I will say that I've worked with hundreds of public health people around the world, and every single one has a singular goal in mind, and it's to better people's health, and to make sure that people have access to medicine, to have people have access to good health care, to make sure that people lead healthy, happy lives. That's what they care about. Because if you work on public health, you are traveling, especially in global health, you are traveling to really bizarre places and eating really weird shit.
Yeah.
And you're doing it not because you're getting paid a lot, because you're not getting paid a lot. You're doing it because you love it, and you're doing it because you love the people. So when I see these conspiracy theories, it does sort of irk me a little bit, because I'm like, man, go after conspiracy theories on bankers all day long.
Yeah.
Sure. But public health people, come on. So.
Right. It's like, let's not attack the people who really could use a lot of help right now. But I want to say that in the case of the COVID mapping project, one of the things I think you guys have really, I don't know if there's women as well on the team, has done a really good job about is really not only constantly updating things, but it's also very user friendly in the way that like some of the other stuff just isn't generally like accessible in a way. Was that intentional, or that just kind of happened that way?
No, it's very intentional. And I'm glad you brought that up, because I was talking to somebody yesterday, and I just coined this recently. But whenever we build visualizations or data things, we sort of aim for what I call the mom test, right? And I mentioned earlier, my mom, I love her to death. She's like my hero, but she's not a data person, and she's 75. She'll be 75 next week. Let me be very clear about that. And so I want to show her something. And if she's like, oh yeah, I totally get that, I have succeeded, right? And my problem with a lot of data visualizations is that you show them to me and you, right? Like smart dudes who work in technology. And we're like, what the hell am I looking at? This looks like a freaking calculus problem. That's what I see in a lot of the data visualizations. And that's because it's scientists who are building them. I'm not a scientist, right? Like I'm just a regular dude. And I want to convey complex information, but in a very digestible format, so that again, everybody out there can understand it and know immediately, like, oh, this is what's happening, and I either need to take this seriously, or I can maybe ease up a little bit. So it was very intentional, and in everything we do, we aim to make things very accessible. And in global health, the other thing is it sort of, we've been very fortunate to work in places that don't have access to iPhones, don't have access to iPads or MacBook Pros. They're working on computers that maybe you and I worked on 15 years ago. Yeah. So you have to develop things in a kind of on a crappy resolution, in a way that, again, people who didn't grow up in the digital era, that they can consume.
Okay, and with that said, I want to ask you another question, which is, in regards to what you guys are doing with the COVID mapping project, is there any trends or anything like that you're seeing? Because like you said, a lot of people are saying, well, the data says that everything is fine now. It seems like the virus is over, we can get
Yep.
back. Like, what do you want to say to people who say that kind of thing?
Yeah, so I think the two things that we're seeing is that one, we're still simply not testing enough, which I know people are saying, like all the public health people are saying. But if you look at the data, in Georgia specifically, and I tweeted this out maybe this morning, the Georgia has almost doubled the amount of tests it's done, which is great. But if you compare it to the rest of the country, actually, we're the same boat as everybody else. We're still number 29 in terms of testing per capita. So they need to test more. It's not really a trend, but it's an observation. The other trend that we're seeing is that we are very focused, and we've gotten away from being so focused on New York, which is good because New York is its own beast. But New York really attacked this very aggressively, and they are trending down, so that's good. But there are rural areas that are not trending down, and I think in Georgia, everybody's been talking about Albany, but Hall County, areas where you have large immigrant populations, where you have disadvantaged communities. Those are the trends that we are interested in tracking. In fact, we're rolling out sort of county by county dashboards in the next couple of days and weeks, where we'll start drilling down even more localized to see what the trends are, because the reality is COVID's not going away in the next 6 to 12 months. And I think what we're going to be finding is that we want to really understand where this is happening and where are the outbreaks, again, more localized. And those are the trends that we're watching and really keeping a closer eye
on. Okay. And we're going to wrap up soon. Is there anything you want people to know about COVID mapping project or your company in particular, or what you're doing outside of those two things?
No, I think just visit the website, covidmappingproject.com. We love feedback. So if something doesn't seem right, something doesn't work, you want something added, we're very responsive. There's a feedback thing at the bottom. You can find me on Twitter at TJ Muehl, M-U-L-E. And I'm pretty responsive to most things. But yeah, happy to kind of contribute any way we can.
No, and thank you so much, TJ, for hitting me up and us getting a chance to talk about this. You guys, if you haven't already, please check out the COVID mapping project. It's actually really cool. And everything TJ is saying to you is definitely worth checking out. It's one of the few places where you can see something and understand what's going on in real time. And it's good to have that. And it's good that somebody who has had his foot in Atlanta for a minute is contributing to something that's meaningful to everyone. And so, again, COVID Mapping Project, so COVID mappingproject.com. And I would make sure that you guys follow TJ on Twitter. And also, once again, if you guys are checking this out for the first time, make sure you like the video, share it to a friend, and let people know. If you're listening to this on SoundCloud, iTunes, wherever you heard this at, make sure you like and review it as well. And once again, I'm King Williams. If you like what you heard, make sure you follow me on Twitter at IamKingWilliams, or you sign up to my newsletter at iamkingwilliams.substack.com. So iamkingwilliams.substack.com. Or once again, if you are still listening and subscribing, make sure you subscribe on iTunes, SoundCloud, wherever you heard this podcast. Thank you very much again, TJ, for coming in, and I look forward to talking to you later.
Thanks a bunch.
All right.